Hello, everyone. Welcome to the Attorney General's press conference this morning. We'll be getting started in just 1 minute. We do have a press release available on our website currently. We will send a press release and a recording of today's press conference following this meeting. Attorney General Miller.
Good morning. Today we're unveiling a new website that is a real aid to people that suffer from opioid use disorder in terms of a path to recovery. IowaOpioidHelp.com, the website, provides that pathway to treatment centers and other resources. Let me just go back a minute or two, for a few minutes, and talk about how we got here, the unfortunate tale of what happened. About 25 years ago, Purdue Pharma embarked on an audacious and deadly campaign to switch the use of opioid prescriptions in America. And essentially, they fooled the medical profession for the most part. And opioids in 1996 were the way it should be. They were the pain treatment of last resort. They were given with enormous respect and concern about addiction. 10 years later, they were one of many options, equal options in a large way, without that fear. As a result, we suffered a real epidemic in terms of use of opioids, addictions, deaths for a long period of time. We in the Attorney General's office became very concerned about that, particularly the deception that was taking place, and have investigated, sued, negotiated for 5 years now with the opioid companies. And we're in the process now of having settlements that will provide money to help with the enormous damage and victims that took place. We recovered about $178 million for Iowa over a rather long period of years from 4 of the largest in terms of finances, Johnson & Johnson and the 3 distributors. We're doing more work with Teva and a number of others where Iowa has taken the lead. And I think eventually Iowa will receive about $225 million over a long period of time, admittedly. That money is going to be divided between the state and local governments, the cities and counties. So, you know, we now have an opportunity to make a difference and do some things that are right. And this is one of the first steps, what I think is an extraordinary website that strikes the really important theme about a treatable disease. Both of those are really important. Addiction is basically a treatment. It's not a status of life. It's not a series of wrongdoings. It's a disease. It should be treated as a disease, and it's treatable as a disease. Drug treatment can work, particularly when people have all the options available. There are two basic kinds of drug treatment. One is the abstinence, and a lot of good work has been done in that area. The other is MAT, medications for addiction treatment. And the MAT basically works this way. It's a low-grade opioid that's given to people on a regular basis under a medical or doctor's care. And the key is that it satisfies the cravings without providing the highs. And people can use this for extended period of time if necessary and live ordinary lives, just like us. And that's really important. It's important that people get in the right program. The abstinence works well for some. The MAT works well for others. It's important that people get into the right treatment. A real breakthrough for the state, I think, is some work that's being done at the University of Iowa hospitals and clinics. Just extraordinary work that's being done in this area that focuses on the MAT side of it. Dr. Jerry Clancy and Dr. Addison Lynch lead that and are just incredible resources, incredible practitioners are helping people all the time, driving the agenda for change. And we depend a lot on them. All of this sort of comes together in a way in the website, that it's a treatable disease and people are given places that they can go for drug treatment and other resources. The treatment facilities that are on the website, and we're willing to expand this, have two characteristics. One is they provide both abstinence and MAT, and they are the groups that if there's no funding from insurance or Medicaid or someplace else, then they do provide the treatment. But we can add others. One, I want to give some real credit to Strategic America that developed this website. We worked a long time with them. They're a great partner. They've been great to work with, and have just from the beginning got the right tone for this disease and the ability to treat. With that, let me turn it over to Lynn Hicks, and Lynn is going to give you some demonstration of the website. Lynn.
Hello, everyone. I'm going to give you a run through of the website, and you can, everyone, it is active now. If you go to IowaOpioidHelp.com, and from the very start here, the idea of the website is to send the message that opioid use disorder is an illness, and like other illnesses can be treated. And so we want to let people know that help is available by going to this website. And we're trying to also reduce some of the stigma related to this, this disorder. So not only is this aimed at people suffering from opioid use disorder, as well as their loved ones who want to try to get them help, but also to the public to let them know that this is an illness. I won't press on these now, but these buttons will send you below to the page to find areas that the user can find help. As A.G. Miller talked about, part of what we're also doing is explaining what medications for addiction treatment, or MAT, is and what it does. It's compassionate, scientifically proven care. We have developed a partnership with the University of Iowa Healthcare, which has an MAT clinic, and we are providing resources to them to also train providers around the state in MAT techniques. We have this video, which I'm going to show. It's about 2.5 minutes, but I think it really captures what MAT is and what they're trying to do at the University of Iowa and the success they're having.
We do a lot of
There's several reasons why we have this misconception that it's not treatable. One is there's a stigma because people don't choices. Thinking about it.
You get through this.
As I said, we've all just sort of absorbed this idea. Well, as you go into MAT stands for medication for addiction treatment, and treatment is very effective, and it's pretty good. It also prevents withdrawal symptoms, and we don't have to work on having great. That's it's not like just I think a lot of people who it's not like they have lost control of their own. They start treatment. They feel like they can control their life. The great speed is just don't understand. Get rid of these things.
Members of council and masters of such work. Things
course, they might still receive, so they might still take stuff.
Safer.
Just that self-confidence and sense of empowerment, and it helps them build some of those skills for being successful with their next.
So that video was produced by Strategic America, obviously with the help of UIHC. And I think you can see when we visited over there, we saw, they're doing amazing work and they really are saving lives and changing people's lives. And this website, again, is intended to help people find those resources, not only at UIHC, but around the state. This map is of the integrated provider network. So these are providers around the state that are contracted with the state. And as A.G. Miller referenced, they are the provider of last resort. So it's not an issue if ability to pay. So people can find whatever area that they might be living in. They can see, for example, in the Des Moines area, the service area 14, what resources are available there. Now, you can live outside this area and still use the services there. For example, if you're in Dallas County, you can use any of these around here, including the one in Creston. So you're not limited to that area, but this is the way that the state divides up the IPN. Similar information is found here and includes a link to the specific providers if people want to go there. You also see references to these footnotes here. Those indicate other services they provide, such as residential services for adults, methadone treatment, and specific treatment for women and children. So again, people can click on these to get more information about these providers. Those are the numbers that I referenced. And then again, you saw Dr. Lynch in the video. So we have a Q&A here. Part of this is trying to demystify the treatment and opioid use disorder. And so we have, she sat down with our team to answer a lot of questions, common questions that people have. So we've included this FAQ to do so. And then at the bottom, we have other information. If people are interested in knowing more about the settlements that we have reached, we have links to our website on that. Again, this is, we'll continue to add information to this website, including resources for people and links to other providers.
Yeah, Lynn, if I can make just a couple more points here. One is about the University of Iowa Hospital and Clinics program that we've seen here. They're going to be funded by $3.8 million from the settlement with the opioid companies. And one of the things that they're going to do is be available to give training throughout the state, particularly in rural areas of the state. You need significant training to be able to administer MAT. The irony is that you need all that training and need very little training in terms of prescribing opioids that got out of control and caused this problem in the first place. One of the things we think in terms of spending the money is that it should be used on prevention. It should be used heavily on treatment, but also we should try and make sure that the benefits are throughout the state, and particularly that the rural areas are not left behind. One of the things that the grant provides through the University of Hospitals and Clinics, Dr. Lynch and Dr. Clancy, is that they will train these doctors and practitioners throughout the state, particularly in the rural area. And obviously think that's important. Also want to acknowledge my staff, Patrick Madigan and a number of people have worked really hard on this whole set of issues, but in particularly on this website. And they've had a great partnership with Strategic America. They're trying to, Patrick and Strategic America, trying to redo history. They did a great job together when we had the terrible mortgage crisis, the foreclosure crisis, and helping people in that situation. So we're trying to duplicate that success. We hope we do, because this is just so important to people, and it affects a lot of people in our state, and it affects their family. It's an enormous, when someone's addicted, it's an enormous effect on the family, and we're sensitive and caring about that as well. So Lynn, you take it away from there. I've had my 2 shots at it.
With that, we will open the chat for questions. If you would like to ask Attorney General Miller a question about the website, please use the raise hand function and we will unmute you. Our first question comes from Caleb McCullough.
Hi, Attorney General. Yeah. So just to for some clarification, is the network of providers that is shown here on this website, is that something that already existed in this website? Just helps to allow people to quickly find where to find treatment, or how is there anything, I guess, that the state is doing in this program that is kind of new, or is this more of just a public way to find those resources?
These are all pre-existing programs, good programs that that do have the 2 qualities that I described. We can work wonders in the AG's office, but not and Department of Health, but not over a period of months produce this list of programs. The programs are all pre-existing.
Okay, our next question comes from the chat from Christy Hagan. Who should doctors in rural areas contact for training and information?
Well, then they should contact Dr. Clancy and Dr. Lynch at University of Iowa hospitals and clinics. And that's one of the major programs and objectives of the grant. Definitely contact those 2 doctors. That they're wonderful doctors, and will be very, very helpful, and delighted to help.
Okay, our next question comes from Caleb Whitman.
Hi, yes, very glad to see this kind of thing coming out. My question is, what had prevented Iowans in the past and current day from seeking this kind of help?
Well, I don't think there's anything there's nothing that prevented them from seeking this treatment. MAT has been around for a while, but it's, the emphasis, frankly, for a long period of time has been on the abstinence. But MAT has been around for a while. What we're trying to do is give a lot more information and a lot more knowledge and a lot more understanding. Part of the reason MAT did not develop as rapidly was because of people's concern about the disease, concern about the addiction and the stigma that attached to the addiction. So one of the things we're trying to do is remove the stigma, so people feel more comfortable doing this, and the public is more supportive of it, and it happens more often. But it's been available for some time.
Okay, our next question comes from Zach Fisher.
Yeah, hey, morning, Attorney General. I just had a question. The press release, you talked about how opioid overdose deaths increased by 21% from 2020 to 2021. First responders using more and more Naxalone to counteract overdoses. I don't know if there's any statistics that you guys had of people actively trying to reach out to seek help, whether that be through abstinence, whether it be through these programs. Is there an increase in people trying to find these programs? Is it family members signing them up for these programs? I don't know your thoughts on that.
Yeah, we'd have to get the statistics from the Department of Public Health on that. But you referenced the deaths. The deaths are largely because of fentanyl. Fentanyl is the scourge of this area right now. Fentanyl is just so deadly, more so than heroin or cocaine or opioid prescription drugs. It just is so much more dangerous and addictive as well. And what has happened is that it used to, the products used to come from China. They no longer come from China, but China then exports the fentanyl, the raw fentanyl, to Mexico, and the products are coming from Mexico. And they lace an opioid pill. They lace heroin and even meth with fentanyl, in part because it's cheaper for them than the other substances. And people don't even realize they're getting it, and can easily overdose and die because it's so powerful and they're not used to it. They're not looking for it. They're not used to it. They're comfortable. The system that does it, isn't used to it. So, my appeal to Iowans to, have a drug disorder, opioids or others, and to their families is that it's just so dangerous. It's so dangerous now with fentanyl being out there, and you can die without even having any idea of the risk you're taking. All the more reason to go to treatment. Treatment just makes so much sense always, but particularly now with this scourge of fentanyl on the scene.
Another question from Zach.
Yeah, just to follow that, could you talk about what you saw was the big need here? Was it all these facilities, all these houses and resources available for people, and not people not knowing how to reach out and find that help? Was it like the statistics as you were just talking about with the deaths? I mean, what was the main driving factor here to put 3.8 million to kind of create this website to connect people to this network?
Yeah, because MAT was not being utilized to near the degree that it could be and should be to help people. For some of the reasons I mentioned before, the stigma, the conception that the usual program is abstinence, that it just wasn't being utilized, and you can see from the theme of the website that we're trying to create. And hopefully it will create a different sort of perspective for Iowans, that it's a treatable disease, emphasis on both treatable and disease. And also, as I mentioned before, doctors need a lot of significant training to be able to dispense these medications. And that's what this program at the University of Iowa will do, is help train the doctors and practitioners.
Just to clarify, Zach, I think you mentioned 3.8 million is for the website. I just want to make sure that 3.8 million is what is the grant that's going to the University of Iowa Healthcare to expand their MAT clinic, to do the training of doctors around the state. They've hired a couple of physicians. They're hiring other staff. So that's what that money is being used for. That is separate than this initiative to start the website.
Yeah, and good catch, Lynn. And the 3.8 million is for 4 years or 5 years. It's an extended period of time. We're going to get enormous benefit from that money from the doctors at the University of Iowa hospitals.
Thanks for that clarification. I appreciate it.
So we have another question from the chat. This one is from Christy Hagan as well. She says, I'm a prevention specialist working on the Iowa SOR project in Mills, Harrison, and Potawatomi counties. I am working with our drug and mental health courts to try and get individuals on MAT before they enter jail and or be allowed to stay on if already on. Is there any legislation that currently exists to support this? Any other supports and models in place in Iowa? This is for the Potawatomi County Jail, and we do have an MAT program in Council Bluffs where jail is located.
Yeah, I don't think there's specific legislation that covers it, but we'll do some research and get back to you. And thanks for your work. What you're doing is just terrific. And you mentioned, I think, drug courts. Drug courts are just an enormously important piece of solving this problem. They have facets and aspects of it that support each other and produce great results. I was up in Dickinson County recently and stopped at the sheriff's office and had a nice visit with the sheriff's deputies and other people that are working on these issues in Dickinson County. And they're doing something that really makes a lot of sense to me, and that is the county's money that comes from the settlement, the counties and cities get half, the state get half. They're partnering with Clay County and doing a drug court, which is just a great idea. We're gonna, I think, do a statement sometime soon and encourage other counties to do the same thing.
Time for any more questions?
Well, these are all great questions. You don't want to cut them off, do you?
Caleb McCullough.
Yeah, sorry, one more just to, another, I guess, clarification question. So these providers that are listed on the website, can people get treatment for free at these places, or what's the contract with the state exactly, and how does that work, I guess?
Yeah, I mean, they're funders of last resort, which means that obviously if people have health insurance that covers it, if Medicaid can cover it, it's covered. But if the person who is ill and treatable with this doesn't have any resources, doesn't have coverage, then the program covers the cost of treatment.
Any final questions?
Well, thanks very much. Thanks everybody for joining us.
Just one final note, the press release, like I mentioned, is on our website, but we will be sending one out via email shortly with a link to the recording of this meeting. Thank you, everyone.
Thank you.